This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Type 2 diabetes, known as adult onset diabetes, has a new target: our kids. This type of diabetes, known to be caused by obesity, is skyrocketing in people under 20. And as Delmarva Life's Brian Spiros tells us, the younger you are, the faster type 2 diabetes progresses and the harder it is to treat.
They do it again and again and again, sometimes 10 times a day.
I was scared that it was going to hurt.
I feel like I've been dealing with it all my life.
Trinell Mays has been living with type 2 diabetes since she was 13. She's part of an alarming, growing dangerous trend.
10, 20 years ago, this was unheard of. When we had a child with diabetes, that child had type 1.
In the last 5 years, type 2 diabetes in children has doubled. Columbia University's Dr. Robin Golan says her youngest patient is now just 8 years old.
That's what we're seeing, is these very overweight children, teens, and young adults getting what used to be an adult form of diabetes.
Type 2 diabetes begins when the body develops a resistance to insulin. When the need for insulin rises, the pancreas gradually loses its ability to regulate blood sugar.
We're seeing an accelerated course of diabetes.
An NIH study found that half of all newly diagnosed teens failed to maintain stable blood sugar. 1 in 5 suffered serious complications as a result.
The first kids with type 2 diabetes had worse cholesterol and triglycerides than these older men and women who were already having heart attacks.
One hurdle for doctors: the medications metformin and Avandia used to control type 2 diabetes in adults is not working as well in children.
And unless we do drastic measures to prevent it, this will be a huge problem.
Family history and poor eating habits are red flags, and researchers now say how your child spends their day could also have an impact. A study by the Mayo Clinic shows for every 2 hours of TV time, the chance of developing type 2 diabetes increases by 20%. So who's at risk? Well, according to the Centers for Disease Control, 17% of Americans under 20 are obese and at risk. And just to show you how much the problem has increased, in 1990, less than 3% of new cases of type 2 diabetes were in Americans under 20. In 2005, it was 45%. So what can we do? Is this a problem that can be solved in the doctor's office, or is it a social problem? Here to shed a little more light on the issue is Dr. Robin Baweja, pediatrician with PRMC. Thank you for joining us this afternoon. This is all really so alarming. First of all, why do you think that we're seeing these increased cases?
So unfortunately, with type 2 diabetes, a lot of the link is associated with obesity. So there is a true linkage with children who are overweight, starting from the ages of probably 4 to 5, that are at that increased risk, and as they get older, they subtly show signs and symptoms of diabetes, and that's just pretty much when they get diagnosed.
So you could probably, parallel the obesity rate and the diabetes rate through the years.
Definitely.
Yeah. What are there symptoms that we should be looking for in our kids?
So unfortunately, the difference between type 2 and type 1 is that type 1 usually shows signs and symptoms pretty early, but with type 2, a lot of them are masked, and a lot of times they don't get diagnosed until they're screened at their doctor's office, because they just show those signs of obesity, so they start screening them for sugar and glucose. But if they do develop signs, they do vary from child to child, and they do develop signs such as increased thirst, increased hunger, unexplained weight loss. Sometimes they have an increase in urination. Sometimes they have an increase in skin infections, which they usually
they don't connect. Yeah.
Exactly.
All right. Does a child have to be overweight?
Yes. Unfortunately, that's sort of one of the most prevalent signs and symptoms of type 2 is obesity. In general, there are other risk factors such as racial, ethnic groups. In addition to that, some family history does coincide with type 2, but more and more it's obesity that correlates with it.
Oh, what about long-term health problems? Kids who are getting type 2 diabetes at age 13, could they have bigger problems down the road?
Right. So a lot of long-term effects are usually associated with vision, kidney, any heart-related problems. They might show signs of hypertension, any atherosclerosis as they get older. But more so, what the long-term effects are usually with the obesity itself, and those more so cause more social and medical consequences as they get older.
Sure, sure. If we start reversing the trend now, will that help put this whole diabetes epidemic in remission, do you think?
Definitely. Type 2 diabetes is curable, and a lot of people don't understand that. As they tend to maintain a healthy lifestyle, they start to lose weight. These things can get controlled, and they could actually be off the medication pretty quickly.
But they gotta start working on it now. And now
Exactly.
you have there's a new program. It's called Healthy Us.
Yes.
And tell us about that.
So it's a new pilot program in collaboration with Peninsula Regional Hospital and the YMCA HIP program, which is already pre-existing. So which just started about 2 weeks ago, and we're actually trying to do it a 12-week program every season, so fall, winter, summer. So the session's already going on for the fall. And basically it's a collaboration of trying to actually get children to focus on their weight and actually get a lot of family participation, because we do feel that families play a key role in the child's health.
So this 12-week program is for the entire family?
It's for the entire family. They get free membership for the YMCA for 12 weeks. They get snacks and nutrition for that actual day, and they get a free medical consultation and dietitian. So
Wow.
it's a great program, and it's actually relatively cost efficient. For those who can't afford it, we do help those families. So if you have any problems, you can contact Amy Sorek at the YMCA, and she'll be glad to give you more information.
Wow, definitely worth looking into.
Yeah.
Dr. Bewaja, thank you so
You're
much.
welcome.
That's
Thank
important
you.
information. And of course, if you would like more information on the prevalence of type 2 diabetes in teens, or if you would like more information about PRMC and this Healthy Us program, go to our website, delmarvalife.com, click on the show tab. Up next on Delmarva Life, the touching story of two families that are adopting children from Haiti, how it's changing their lives and the lives of the little ones they're adopting. But first, as we age, it's so important to make sure our bones stay strong. Dr. Oz has more on how we can do that.
Hi, I'm Dr. Oz. To protect your bones, you need a bone-boosting cocktail of 600 milligrams of calcium, 1,000 international units of vitamin D3, and 400 milligrams of magnesium. Vitamin D aids calcium absorption, while magnesium eases blood vessel constriction caused by calcium. Look for this combination all in one pill.